Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
All right, so today we are going deep on a topic that can be tough, PTSD. And we're looking at this document called What is Post-Traumatic Stress Disorder? PTSD. And really trying to not just scratch the surface, but get some deeper insights into what PTSD is all about. You with me on this one?
Absolutely. I think it's a topic that needs a lot more attention.
For sure. So to kick things off, most people have heard of PTSD, but the document starts with a basic definition. It's a mental health condition triggered by a traumatic event. But trauma feels like a word that gets thrown around a lot. What kind of experiences are we actually talking about here?
Yeah, you're right. It's not just about having a bad day or, a minor setback. We're talking about events that shake you to your core, that threaten your safety, your sense of self. Things like combat natural disasters, sexual assault, serious accidents, or even witnessing something horrific. It can leave a lasting impact.
So this document makes it clear PTSD isn't just a military thing, anyone can develop it. It's really about how our brains process these intense experiences.
Exactly, and sometimes that processing gets disrupted. It's like your brain gets stuck in danger mode even when you're safe, and that's when those classic PTSD symptoms start to surface.
Okay, so before we get to the symptoms, I have to bring up some of the myths around PTSD. I was surprised to learn that women are actually more likely to develop it than men. Any thoughts on why that might be?
It's a complex issue, but research points to a few possible factors. The types of trauma women are more often exposed to could play a role, as well as differences in hormonal responses and even societal expectations that might make it harder for women to seek help. It's important to recognize these nuances.
That's a really good point. And here's another myth buster from the document. PTSD doesn't always show up right away. Sometimes it can take months or even years for symptoms to appear. That must make it tough to connect the dots.
Absolutely. Someone might seem perfectly fine after a traumatic event, then suddenly they're experiencing nightmares, flashbacks, feeling constantly on edge. That delay can really hinder getting a timely diagnosis and proper treatment.
And to make things even more complicated, not everyone who goes through trauma develops PTSD. It's not a guaranteed outcome.
You got it.
Trauma affects everyone differently. Some people have incredible resilience, strong support systems, coping mechanisms that work for them. It's not a sign of weakness to develop PTSD, and it's also not a foregone conclusion just because someone experienced something terrible.
So let's unpack the factors that do increase the risk. The document lists 5 severity of the trauma: personal history of trauma, lack of social support, pre-existing mental health conditions, and genetics. That's a lot to consider.
It is, and what's fascinating is that it's rarely just one thing. It's more like a perfect storm of vulnerabilities. Imagine someone with a history of anxiety who experiences a severe trauma and then has no one to talk to about it. That's a much riskier scenario than someone with a strong support system and no prior mental health issues.
So it's this complex interplay of risk factors that can increase the likelihood of PTSD. And that makes it even more important to understand the symptoms, right? Because we need to know what to look for in ourselves and in the people around us.
Right.
Recognizing the symptoms is a crucial first step, both for seeking help and for understanding what others might be going through. Knowing the signs can make a huge difference, both for getting help and, just understanding what someone else might be going through.
So the document breaks down the symptoms into 4 main categories. The first one is intrusive thoughts. And I think a lot of people can relate to this to some extent. It's those unwanted memories, the flashbacks, the nightmares that just pop into your head, right?
Right, but these aren't your average run-of-the-mill memories. It's reliving the trauma, the sights, the sounds, even smells all come flooding back. It's terrifying because it feels like the danger is happening all over again, even though it's in the past.
Yeah, I can see how that would make it hard to ever really feel safe. Which brings us to the next category, avoidance behaviors. Is this basically trying to outrun those intrusive thoughts?
In a way, yeah. It's about avoiding anything that could trigger those memories. Places, people, activities, even certain conversations. It makes sense you want to protect yourself from that intense distress.
But I've also heard that avoidance can backfire. Doesn't it just make the fear stronger in the long run?
It's a tricky balance. In the short term, yeah, avoidance provides relief, but over time it can actually make the triggers even more powerful. It's like trying to ignore a monster under the bed. It might work for a while, but eventually you got to turn on the light and face it head on.
So avoiding those triggers actually reinforces their power. Makes a lot of sense. Okay, the next category is negative changes in mood and thinking. And the document paints a pretty bleak picture here. It sounds like PTSD can really rob you of your joy.
It can, for sure. We're talking about feeling emotionally numb, detached, hopeless about the future. It becomes really hard to experience pleasure or connect with the people you care about. It's like this fog settles over everything, making life feel dull and meaningless.
That must be so isolating to feel that way.
Mm.
And then the final category is hyperarousal and reactivity. It sounds like your nervous system is constantly on high alert.
Exactly. Picture being on edge all the time, like a soldier scanning for threats, even when you're in a safe environment. You startle easily, you're jumpy, you have trouble sleeping, maybe you're quick to anger. Your body is stuck in that fight or flight mode even when there's no real danger present.
It's really hitting me how much more there is to PTSD than I initially thought.
Yeah.
And the document also mentions that there are different types of PTSD too. Is that about how long the symptoms last?
It's part of it. Yeah, you have acute PTSD where symptoms last for a few months after the trauma. Then there's chronic PTSD where those symptoms stick around for much longer.
But it's not just about the duration, right? There's also complex PTSD and comorbid PTSD.
You're catching on. Complex PTSD develops after prolonged or repeated trauma, like ongoing abuse. And it can involve additional challenges like difficulty regulating emotions or a distorted sense of self. Then there's comorbid PTSD, which occurs alongside other mental health conditions like depression, anxiety disorders, substance abuse.
So it's not one size fits all. PTSD can manifest in different ways for different lengths of time, and it can be intertwined with other mental health challenges. That must make treatment pretty complicated.
It can be. But here's the good news. PTSD is treatable. There are proven approaches that can help people reclaim their lives. And recognizing those different types, like you mentioned, is key to finding the right approach for each individual.
Okay, so let's talk about those treatment options. The document highlights psychotherapy, medication, and holistic approaches. Is there one magic bullet that works for everyone?
I wish it were that simple. Unfortunately, there's no single solution. It's often a combination of approaches that works best. Psychotherapy is usually the foundation. It helps people process the trauma, develop coping skills, and challenge those unhelpful thought patterns that keep them stuck.
So it's about understanding the roots of the problem, not just masking the symptoms.
Exactly. And there are different types of therapy that can be helpful. Cognitive behavioral therapy, or CBT, is a common one. Helps people identify and change those negative thought patterns that contribute to their distress.
I've also heard of exposure therapy. Is that where you're gradually exposed to the things you're afraid of?
Yeah, that's the basic idea. It's done very carefully with a trained therapist to gradually reduce the fear and anxiety around those triggers. And then there's EMDR eye movement desensitization and reprocessing.
That one always sounded a bit mysterious to me. What's the deal with the eye movements?
It was actually pretty interesting. You basically focus on the traumatic memory while your eyes follow a specific pattern. It's thought to help reprocess the memory in a way that reduces its emotional intensity. It's not about erasing the memory, but changing how it affects you.
So you're not forgetting the trauma, but it's not controlling you anymore. That's a really powerful distinction. But therapy can be intense, facing those painful memories head on. Is medication sometimes used along with therapy?
It can be. Medications like SSRIs, which are antidepressants, can help with mood regulation, anxiety, sleep problems, all things that can be significantly impacted by PTSD.
And what about prazosin? I think I saw that mentioned in the document. What does that do?
Prazosin is interesting because it's not an antidepressant. It's often used specifically for nightmares, which we know can be a really distressing symptom of PTSD. It helps improve sleep quality by working on different pathways in the brain.
So it's more of a targeted approach to a specific symptom. It seems like there are a lot of options, which is encouraging. But what about those holistic approaches we mentioned earlier? Where do they fit in?
So holistic approaches, they're really about supporting both your mind and your body. Things like mindfulness, meditation, exercise, even nutrition, they all play a role.
Yeah, it's like giving your body the tools to regulate itself, to kind of come down from that constant state of stress that PTSD can cause. And I think that the document actually mentions some specific natural remedies that have shown some promise in this area.
It did, yeah. There are adaptogenic herbs, which basically help your body handle stress more effectively. Things like ashwagandha, rhodiola, holy basil, they all work in slightly different ways, but the goal is to bring your system back into balance.
So it's not about erasing the trauma, but about making you more resilient to its effects.
Exactly. And then you have those brain-boosting amino acids, which are compounds that can help with neurotransmitter production, those chemical messengers in the brain that often get disrupted by PTSD. GABA, for example, is known for its calming effects.
Oh yeah, I've heard of GABA supplement. Take those for anxiety, right?
They do, and it can be really helpful for that hyperarousal that comes with PTSD. Then there's L-theanine, which is found naturally in green tea. It also promotes relaxation, but without that drowsy effect.
So it's like a calmer alertness, not just sedation. It's interesting. And the document also talked about sleep support, which makes sense if you're having nightmares and feeling constantly on edge. Sleep is probably the last thing on your mind.
For sure. And poor sleep just makes everything worse.
Yeah.
There are some natural remedies that can help, things like magnesium, melatonin, certain herbal teas. But it's also about creating a solid sleep routine that promotes relaxation.
Right, like turning off screens an hour before bed, having a warm bath, that kind of stuff.
Exactly. It's all about sending signals to your body that it's safe to wind down and rest.
This deep dive has been so eye-opening. I feel like I've learned so much, not just about, the facts and figures of PTSD, but about the human experience behind it.
I agree. And I think the biggest takeaway here is that PTSD is complex, it's varied, but most importantly, it's treatable. There's no shame in seeking help, whether that's therapy, medication, or exploring those holistic approaches we talked about.
Absolutely. And the more we understand about PTSD, the better equipped we are to support ourselves and those around us who might be struggling. So if you're out there listening and any of this resonated with you, please don't hesitate to reach out to a mental health professional. There is hope and there is help available.
Couldn't have said it better myself.
Well, that wraps up our deep dive into PTSD. We hope you found it insightful and, more importantly, hopeful. Until next time, keep learning and keep taking care of yourselves.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.